had several requests for a foam rolling video, so I'm gonna do it. Here we are. As far as foam rollers are concerned, you've got a couple different options. A smooth roller is a good place to start if you are just starting to foam roll. It's a little bit less aggressive, it's generally a bit softer, and so it's going to be more tolerable to tense, tight muscles and tissue. Rollers such as this one with a little bit of texture is like the next step. I prefer something like the rumble roller for getting into some of the bigger, bulkier muscles such as the quads, hamstrings, calves. Those muscles are very dense, very long and ropey, and having these knobs help get in and kind of split the tissue so that you're getting some space, you're getting some blood flow. Sometimes the smoother, flatter rollers tend to just smash everything down where we want to get in there and separate and break it up. So the ITband would probably be the exception to the rumble roller. If you want, you can absolutely get in there, but there's not a lot of depth to that tissue. The lateral side of your femur is pretty exposed, so it can be a little brutal. Maybe choose one of the less aggressive rollers. So using the rumble roller, if you were gonna get into your calves, I would start low, just kind of at the junction of the Achilles and the calf muscle. You never wanna be rolling directly on bone, okay? So always the soft tissue stuff. Crossing one leg over to get a little extra pressure. You can start here, just working with the legs to go up and down, okay? To add a little bit more force behind what you're doing, you can take the weight of the body into the arms, lifting the hips, and then you can do the same thing. You can work one segment, or you can go for the full kind of up and down length of the muscle. I think it is good to do both. Sometimes warming up with small segments makes it more tolerable when you then lift the hips and go with the full roll. So break it up. Maybe you start with that lower third. I like to do inside, backside, outside, and then move up a level, and you're working again all around, and then another level up as well, okay? For the hamstrings, it's very similar. Getting that roller just above the back of the knee, crossing the leg again for a little bit of added pressure down, and then you're rolling full length behind the knee, and then up almost to your sit bone, okay? Again, you got that up and down movement. You can work segments. Definitely get into inside and outside. The outside here, where the ITband and the hamstring tendons are coming down, can be a particularly bindy spot. It's very problematic if we're talking about any like friction, runner's knee, ITband syndrome type things at the knee. Sometimes it just adds a lot of compression type pressure to the knee where you get the tender, achy knee, not very specific to the joint, more kind of wrapping around the front. All of this fascia comes through and around and attaches on the lateral side. If it's tight, it's just gonna grab and pull. So get in there with the roller. Side to side, where you're almost shearing the tissue, is also really helpful. That creates this separation between the layers so that we're not getting everything so like stuck down, okay? Now, I'm going a little bit faster through some of these than I would recommend if we were actually rolling together for the full benefit. We'd still be on the left calf. So I typically say maybe 5 minutes per body area. So 5 minutes on the calf, 5 minutes on the hamstring, 5 minutes on the quad, and then if you can get to 5 minutes on the ITband, that's good. The benefit of rolling the hamstrings and the quad is that that releases the ITband. The ITband is connective tissue that these muscle fibers blend into. the muscle is contractile, and when it gets tight and bound, it's gonna pull on the ITband both from front and back. So if you're releasing that pull, already your ITband is gonna be more mobile. However, similar to this shearing benefit we talked about, getting in and doing that on the ITband helps, again, get each layer, superficial skin, the overlaying fascia, and then the deeper fascia of the ITband to kind of move, slide, glide well over the lateral aspect of the femur, okay? So that's calf, hamstring. Quad, you're gonna flip the other way, okay? Sometimes you may wanna start with both. Again, it kind of warms up, you don't have full weight. I like to start right at the top of the knee, okay? And you're in this like plank position, and you're just rolling that quad tendon. So when you think about where to focus, imagine in the anatomy pictures what would be considered the white stuff. That's the fascia, those are the muscle tendon junctions, and that's where things tend to develop a lot of stress and strain. And so getting in and releasing all that tension is very helpful. Okay, you can come up onto hands. We're in like a push-up now, moving up a little bit higher, and then rolling all the way. So here, double leg, we're just working kind of the up down, all right? If we're gonna move to one leg, we kind of take this side lying position. You can go, I like to do like forearm and hand, other legs helping me push, and again, we're rolling up and down. Take your time. It's not about the faster the better with this. Actually slower and more graded pressure is what actually is gonna give you the benefit. Because if you're just beating it up, your body is naturally going to kind of resist, right? You create tension because of the pain. So just breathe, go slow, work each segment as you're able, okay? You can get up nicely into the front of the hip. So bringing that roller, you're just below the bone, the bony portion of the hip. And here we're getting the top of the quad. You can get a little bit of the TFL, which is a small hip flexor at the top of the ITband. Okay, and again, this is a smaller area, so you're just kind of working slow, working patient. You can even drop the leg and kind of hang out here. I always recommend foam rolling, maybe during your favorite TV show. You're gonna be hanging out, sitting on the couch watching TV anyway. Get your roller out, get on the floor, and just roll, okay? So that's quad. You can shift a little bit posterior. Now we're getting into some of the glutes. What you would want to do to get maybe into the top of glute med, glute min, are both sitting kind of deeper here. Of course, we're getting glute max because it sits on top of both of those. And again, maybe not the rumble roller for these. Maybe you start with one of the smoother rollers instead. But these are kind of more of those trigger point areas where you're not doing the long up-down rolls like we did on the calf and the quad and the hamstring. You're just pressure pointing and kind of patiently working those spots, okay? And then, lastly, for the ITband, we've got maybe a textured roller, and now you're in that full slide lying position. I like to pull the other leg over top to help kind of push-pull, take some pressure off the arms, and then you're going all the way from the top of the knee and then working up to where you feel the greater trochanter, which is that bony aspect on the side of the hip, okay? Top of the femur there. So here we're just making those long passes again, rolling up and down. When you find a particularly painful kind of bindy spot, just hang out on it, let it kind of melt. You can do, again, some of that side to side, kind of shimmy, getting it to unstick, okay? And then if you're feeling pretty good here, you can always do a little bit onto the quad, a little bit onto the hamstring, a little bit extra never hurts. All right, so that is our basic foam rolling for the lower extremities.